All right, and with that, we're going to get started. Welcome to another virtual listening session held by the members of the Board of County Commissioners. I'm Dylan Blaylock with Clackamas County's Public and Government Affairs Department, and I'll be coordinating the comments for today's meeting. Today's topic is masks and personal freedom. Today's listening session will go until 2:30 or until we run out of comments and questions, whichever comes first. But we have had a lot of interest over email, and we've got a lot of people who have commented. The session will be archived to YouTube. This is an opportunity for commissioners and other county officials to hear from the public about your experiences and opinions, your questions and concerns. I'll relay how to provide a comment in a little bit. Please note that due to the volume of comments we have received thus far, we are asking individuals to keep their comments to 1 minute in total. So joining us today are Clackamas County Chair Jim Bernard and County Commissioner Ken Humberston. Chair Bernard, let's start with you for any opening comments that you have. Thank you.
Great, thank you, Dylan. Again, I'm Jim Bernard, the chair of the commission. I want to thank you for joining us today. During this ongoing pandemic, the Board of County Commissioners has prioritized staying directly connected with our residents and stakeholders. We've held many virtual listening posts and town halls during this past few months, really. We continue to see lots of public participation. Today's topic, masks and personal freedom. Kate Brown previously mandated that Oregonians wear face masks covering indoor and public places. Effective today, she has mandated that masks be worn by Oregonians in outdoor situations when you cannot stay 6 feet from one another. Clackamas County Commission has urged the public to wear face coverings in public spaces, but we recognize that some residents feel these orders infringe upon personal freedoms and liberties. We're interested in knowing what Clackamas County residents think about this requirement. Want to hear your opinion, your personal experience and suggestions. And remember, this is a listening session. We may not, or we may respond to some of your comments, but mostly we're here to listen and to hear from hear from as many people as possible. And with that, I'm going to pass it to Clackamas County Commissioner Ken Humberston, and it's all yours.
Thank you, Chair Bernard. Thanks to everyone for joining us today also. You may not know this, but more than 20 states now mandate face coverings in public places. As Chair Bernard stated, all Clackamas County Commissioners urge residents to wear masks in public spaces. We're doing what we can to help stop the spread of the virus. All of the Board of County Commissioners' actions have been informed by our public health expert recommendations, and those are informed by both the CDC and the Oregon Health Authority. To be clear, the CDC recommends that people wear cloth coverings in public settings and when around people who don't live in their own households, especially when social distancing measures are difficult to maintain. The CDC makes its recommendation based on the known science of the virus, and that studies show cloth face coverings reduce the spray of respiratory droplets. We look forward to your questions and comments today, and we're going to try to get through as many as we can. And with that, I'll turn it back to Dylan. Dylan, go ahead.
All right, thank you very much, Commissioners. Appreciate that. Okay, I'm going to remind the audience that today's listening session should focus on masks and personal freedom. If you have a comment regarding anything else COVID related, such as the governor's phase plans or something like that, the Board of County Commissioners always welcomes comment on anything related to county business at its Thursday business meetings, which are also held over Zoom right now because of the pandemic. You can find more information about joining that on the main page of clackamas.us and go to the board's page, which is halfway down. It's got a nice picture of the 5 commissioners. Those meetings generally start at 10 a.m. on Thursdays, but on the 5th Thursday of the month, like the end of this month, they're at 6 p.m. Alternatively, you can also send an email to the commissioners at bcc@clackamas.us on any topic as well. I'm going to show that real quick just so it's very clear. So the BCC, again, welcomes any and all comments related to county business at this email, bcc@clackamas.us. But for today's listening session, in addition to the live comments, we will hear from individuals. We'll be relaying comments we've received over email. If you'd like to relay a comment over email, you can send it to ClackCo@clackamas.us for this meeting with mask listening session in the comment line. Please include your name and keep your comments to 1 minute. Let me see. Okay. And with that, we will go to some comments. So to give a comment, if you're with us, and I see we have 85 people with us right now, you can select the raise hand button on the Zoom bar. That's at the top or bottom, depending on your device. And if you're on the phone, and I see we have many individuals on the phone, you can hit *9, and that lets me go ahead and know additionally that you have a comment that you would like to pass on to commissioners. And I'm also going to bring in multiple email comments at a time, some much shorter than others. I've shortened some in the interest of time, but not many at all. So first, we will go over to someone with their hand raised. Carissa Bristow is the name. So Carissa, if you want to go ahead and unmute yourself, and you are on with the county commissioners, if you can please give your name and your general area of residence and keep your comment to 1 minute. Thank you.
Can you hear me?
Yes,
Yep.
Please go ahead. Thanks.
Hi, my name's Carissa. I live in Lake Oswego. Thank you for the public comment. Living life in a mask is not living. I want to smile at people. I want to be able to fully hear people, and I want to be able to fully breathe. I shouldn't be mandated to breathe in extra carbon monoxide. Masks are a slave device, and it's a keep your mouth shut device. I will never wear a mask outdoors, and asking businesses to have employees enforce these backwards mandates is abhorrent. You took an oath to protect and uphold our Constitution, and now it's time to follow your oath. What kind of world are we creating here? This isn't a future I want. Some of my happiest memories are at festivals and concerts. It's not too late to turn this situation around, but it involves everyone standing up and telling our governor no. My God-given rights don't end where fear begins. I'm a sovereign being, and I do not support any mask mandate. Thank you.
Thank you.
Okay. Thank you very much for that, Carissa. Appreciate the comment. I'm going to go to a couple emails we received because, as I said, we did get a lot of emails on this subject. So I might do multiple ones at a time. This one is from Tonya. My peers who are working on the front lines of the ERs, the ORs, and the ICUs deserve respect for the daily challenges they are facing. They are scared going to work. They are scared going home to their families or roommates. They are scared they may inadvertently and unknowingly spread COVID-19 to their families or roommates, their coworkers, and their patients. My friends and healthcare workers are still reporting having to use PPE in ways that are not in accordance with their standards for use. Near the end of May in Oregon and in Clackamas County, we started to see the curve slow as a result of our efforts, yet the beginning of July is the onset of a steeper upward trajectory. It doesn't look good. These new and increasing cases will likely add to hospitalizations in the near future, further stressing our essential workers. At some point, we may be faced with another stay-at-home order. Mask wearing is the absolute minimum our county and state should be doing if we expect to keep our economy open. It is the least we can do to show our respect for those businesses we frequent and the essential workers who are there for us. And education for appropriate use, donning, covering nose and mouth at all times of masks should be widespread. So again, we thank Tonya for that email comment as well. Okay. And with that, I'm going to go to another call on the Zoom, as it were. Andrea Nelson. Andrea, you are on. If you can unmute yourself, provide your name and your area, and keep your comment to a minute. Thank you very much.
Hi, my name's Andrea Nelson. I live in Happy Valley, and I was just calling in to share my support of wearing masks out in public to help prevent the spread of COVID. I think it's the same civic duty that we all have, as similar to washing our hands after using the restroom. It's easy. We can all do, most of us, well, can do it. and and it feels like it's stepping up and doing our part in a way that generally for most of us doesn't impact our ability to function. It's not comfortable. It's not enjoyable. It's hot outside. I recognize that. But if we all do it now, we don't have to do it for as long of a time. And I just wanted to echo that sentiment that I've heard among others, that it's important for us to support those on the front lines in any way we can and protect those who are even more compromised against this disease. Thanks.
Thank you.
Thank you very much for that, Andrea. Appreciate it.
Thank you very much.
A question that has come in, which is a good one to get in early. This was from Jeff. I think it'll allow both commissioners to explain their views. Where does the board stand on this? I recall an earlier session when several commissioners expressed a desire to set aside safety regulations and standards that might impede reopening. I'm hoping we've gotten past that. If we cut corners to reopen, we're putting it all on the backs of those least able to speak up and defend themselves. If safety standards are important at other times, they're important now. So essentially where is the board on this right now, commissioners?
Ken, you mind? Well, first, it's not a decision I have to make. It's a decision the governor has made. And I support that 100%. You know, you give up something when you live in society. You give up that freedom to, you know, do whatever you want for yourself. You have to do things for other people too. And wearing a mask protects other people. And it's very important that we do that. I think the rules are challenging, but this is the simplest thing we can do. Today I heard the CDC say that if 80% of people in this country wore masks, we could eliminate the virus in 30 days. I don't see why anyone would not do this, because we can open our businesses, we can get back to work, we can send kids to school, but we gotta stop the virus. The virus knows no borders. What happens in Portland will affect us or Washington County. So we need to, I'm very much in support of wearing the mask, even though I often have to go back to my car and get it when I forget it. So you can't.
Well, with freedom comes responsibility. We don't get to do anything we want anytime we want at our own whim. For instance, we drive down the road, we follow speed limits for a reason, because going 150 miles an hour on a road with other people going 65 or 55 miles an hour is very dangerous. And we have a responsibility to other people. But in the case of the masks, quite frankly, it's really personal to me. I'm in the age group that is a risk. 30% of the people in this age group can experience fatalities. While the younger folks, it's much less likely. I'm definitely in that age group. So is my wife, plus she has additional health issues, which makes her even more at risk. And then on top of it, my son and my daughter-in-law both are nurses on the front lines, working with patients and others who are susceptible to this disease, and in some cases actually being treated for this disease. And I don't want to see them get sick because the rest of us were cavalier about this. I go back to the signs I remember seeing in restaurants that still apply: no shirt, no shoes, no service. I don't see the problem wearing a mask when you're around other people until we get through this. So I'm fully in support.
All right, thank you both very much for that, for explaining your views. With that, we are going to go over to the handle. I apologize if I mispronounce it. Jake Gano, or maybe Jake Gano. So Jake, if you are there, if you can unmute yourself and provide your name, your area, and keep your comments to a minute, please. Thank you very much.
Yeah, thank you. Can you hear me?
Yep.
Yes.
Yep, it's Jake Gano, and I'm in West Lynn in the Stafford Hamlet. And a couple of you, my commissioners, just kind of echoed the comments I was just about to make, so I appreciate that. But you know, we have laws that protect us on the road. We have secondhand smoke laws. We have noise safety laws, and I don't see how this is any different. You know, we have to keep people safe, and to me, I guess it's a freedom issue, but I look at my freedom to go out in public safely. I look at my freedom to buy groceries knowing I'm not going to get sick. And my freedom is to do the things that I need to do to survive without being impeded by others. So this is a freedom from getting sick rather than a freedom to do whatever I want issue. And just one other note, if anybody's worried about carbon monoxide, just feel like it needs to be said that we don't exhale carbon monoxide. And that's just we're not asking people to barbecue indoors. So that's my comment. Thank you guys very much.
Thank you.
Thank you.
Thank you for that, Jake. And I see we have some more hands up, which is great. So we will get to those in just 1 second. I'm going to relay some more emails that we've gotten. This one is from Lori. I do not think masks infringe upon our personal freedom. I think US citizens in general need to focus more on responsibility than on entitlement. Wearing a mask shows others you are a responsible, caring person, and you want to get back to some idea of, quote, normal. So that was from Lori. Another, Lexi in Clackamas. Thank you for the opportunity to share how we feel about the mask mandate in our county. I truly believe it is an infringement and even an assault on our personal liberties. Mandates perpetuate the idea that individuals lack the moral or intellectual capacity to make sound decisions for themselves and their children, so the state needs to do it for them. My husband and I are educated, responsible, and independent people who are capable of using the wisdom necessary to keep ourselves and our children safe and healthy. Please do away with this mandate immediately and let people make their own choices regarding their individual health and well-being. Thank you for your consideration.
Well, let me just comment a little bit. It's not our mandate. It's the governor's mandate. However, if the governor hadn't done it, I would support doing it. But that we don't actually, as far as I know, have the powers to do that. The governor does.
All right, thank you very much for that. And thanks for the comments over email. Again, if we have some hands up, if you are an attendee and you would like to make a comment, you can hit the raise hand function on Zoom. That's at the top or bottom of the Zoom bar, depending on your device. And also if you're on the phone, we still have 5 phone listeners. You can hit *9, which lets me know that you have a comment. We will go to, I believe it's Rob Kappa. Rob, I'm going to go ahead and allow you in real quick. Rob, if you can go ahead and unmute yourself. There you go. Thanks very much. Please give your name, your area, and please keep your comment to a minute. Thank you.
Thank you. Can you hear me okay?
We
Yes.
sure can, Rob.
Okay. My name is Rob Kappa. I live in Milwaukee. I fully support wearing the mask because I think it's a good responsibility to be helpful to other people and be responsible for them also. Even when I'm riding my bike on the trails, I wear my mask. And I agree with the 2 commissioners and some of the other people who have talked on it. It's not infringing upon my freedom. It is actually enhancing my freedom to be able to go out, do some grocery shopping, ride my bike. And thank you for the time, and I appreciate it. And it's unfortunate, but this is the situation we're in. And thank you, Chair, and thank you, Keith.
Ken.
Ken, I'm sorry.
It's okay.
He's from Milwaukee. He can't help it. I know, Rob.
Yeah.
Just stay healthy.
All right. Thank you very much for that comment, Rob. We will go to another Zoom call real quick. This one, again, my apologies if I don't get it right. Carol Leitsky, maybe Leitsky. That's the handle. So Carol, if you could go ahead and unmute yourself, there you go. And please provide your name and your area and keep your comment to a minute, please. Thank you.
Hi there.
Hi.
I'm glad to be able to be with your meeting. It's Litsky. You were very close.
Okay, sorry.
I get used to Carol. Anyway, I'm a retired certified nurse midwife, and speaking in terms of carbon dioxide, I would wear a mask sometimes for 1 to 2 hours consistently in surgery, and there were no issues in rebreathing my own carbon dioxide. My other real point is that we are a society of me first, my rights, my privileges, and we should be, in this instance, I think, more of a society that is globally looking at everybody's rights and everybody's freedoms. The freedom to be able to go out with a mask on and interact with other people and to be able to be part of a community is important to me. I think there's too much concentration on the me and not enough concentration on the good for the whole of the country. If either my husband or I were to contract COVID because we have comorbid medical conditions, we would likely not survive. And so to me, the people that are so interested in what their intellect tells them that they can do, because they know what's best for them, they're not thinking about other people and what their needs are. And I think that's a very, personally, my opinion only, maybe a selfish attitude. Thank you for letting me join today, and I appreciate the support that's being given to the mask wearing issue. Thank you.
Thank you.
Thank you for your comments.
Very much, Carol. Okay. We still have more hands that are up. We'll get to those in a second. If you have just go ahead and hit the raise hand function on Zoom. If you want to make a comment, I'm going to go through a few emails here, commissioners, that we received. Ellen in Gladstone. I would like to think that we would all comply with basic health practices in order to protect one another. Don't spit in someone's face, for example. Government has legislated safety measures for the common good that have had a positive impact on reducing mortality. Helmet laws for motorcycles, seatbelts for automobile drivers and passengers. The wearing of masks in a time of pandemic is not an individual infringement. It protects the general population from infection from a person currently asymptomatic or symptomatic. By extension, it protects healthcare workers and first responders, as well as others who are working to provide necessities and conveniences for all of us. I would like to think that we would all comply with basic health practices in order to protect one another. That was from Ellen in Gladstone. Another from Jamie. Do we need to rewatch Schoolhouse Rock? The governor cannot make the laws. Leave lawmaking to the legislature. Side of the box for N95 clearly states does not protect against COVID-19. Why are we being forced to wear cloth masks? That one is from Jamie. Okay. From Cheryl in Damascus. I want masks to be worn at all times outdoors, including entering into and leaving a restaurant. It greatly reduces the chances of COVID spread. It's not a big ask for anyone to comply with, and it's much better than a lockdown. It was from Cheryl. We'll do one more before we go back to the Zoom. From Patricia in Welches. My freedom says no one has a right to infect me with a deadly virus by not wearing a mask. Wearing a mask is a safety measure, no different than having to wear a seatbelt in a car or other safety laws we abide by to keep ourselves and others safe from harm. So those are 4 quick emails. And we again thank everyone who has sent in an email. So very good. And with that, we are going to go to the next Zoom call. Robert, maybe it's Bockelder. I'm sorry, I'm just not having a great day with name pronunciations. So Robert, you are on. Great, you've unmuted yourself. If you could please give your name and your area and your comment to a minute. Thanks.
Okay. Yes, my name is Robert Batchelder from Oregon City. And to me, it's not a question of personal freedom. If there was a contagious disease epidemic that could be combated with wearing face masks, the authority of the government to make such mandates for public health is well established. The problem to me is that there's no emergency to justify these measures here and currently even really in the United States. While we did have deaths above the threshold of an epidemic, according to CDC numbers for a time, that's not unusual. It happens every year. And we didn't even reach the number of flu deaths that we saw in 2017 in total this year. And the current numbers for Oregon are well below the epidemic threshold. So invoking emergency clauses and taking these sort of extraordinary measures seems like a blatant abuse of power to me at this point. And the fear-mongering around it is baffling to me. Further, the assertions that a disease will be eliminated by wearing masks is ridiculous given 100 years of virus research and current studies that show COVID is easily transmitted through masks. So I don't really understand where anybody gets off saying that we're going to be able to eliminate this by wearing masks. That's not how viruses work. Masks are for preventing bacterial infections. Thank you.
Thank you.
Okay. Let's see. Thank you very much, Robert, for that call. Let me see. Next, we will go to, sorry, I got to clear my screen. It's either going to be Nina or Nina Alter. So Nina or Nina, if you can go ahead and unmute yourself. Yep, I see that you have. And if you could give your name and your area and your comment in a minute or so. Thanks very much.
It's actually Nina, but I
Okay.
really appreciate you being more gracious than my substitute teachers in childhood did. I'm in Sandy. I know. I'm calling from Sandy, and I wanted to say that the First Amendment is very near and dear to me. I work for a First Amendment nonprofit, and I love the zeal for the First Amendment that I'm hearing in so many of the callers. As Jim said, however, with great privileges come great responsibility. As a resident of Clackamas County, I am emotionally exhausted by the masses insistent on doing their own research who do not have the training to credibly endeavor in such research. At the end of the day, it's a fabric mask. That is all anyone is being asked to wear. I implore county leadership to please take a stand, not in amplifying federal or state policies that seem to be dividing us, but perhaps by amplifying and offering credibility to the research from academia that has validated the risk, transmission, and consequences of COVID. It's a pandemic globally. That's just how epidemiology works. The risks have been established by the experts. Their voices need amplification. I'm so tired of being labeled a fearmonger for heeding the research and recommendations of institutions such as Johns Hopkins, the Mayo Clinic, and so many more. Forcing children to stay at home sucks worse than anything imposed upon adults. Losing our elders, my parents who are both in their 80s, I could not even imagine. We owe it to our kids, our elders, our first responders, and our frontline workers more than anything else. I'm asthmatic, I wear a mask, you can too. Thank you so much, Dylan.
Thank you. You know, I realize that Oregon has done a really good job. We really have. We've flattened the curve for a while, but that's not happening now. It is climbing. We need to do something, and we can't just sit back and let it, you know, the virus has sees no borders. More people are dying. While it seems to flatten for a while, our percentage of cases is climbing. A simple mask can, whether somebody thinks it cannot, it does make a difference. That's what our professionals say. I'm not a lawyer. I've never played a doctor on TV. I support the First Amendment too, and the Second, and all of them. But it's a simple thing to do, is to wear a mask. The CDC, like I said earlier, said that if 80% of us wore masks, we could put this virus away in a month. And I don't know why we wouldn't want to do that. You know, we hear about the desire to open our businesses back up. We can do that. All we got to do is wear a mask. We can send our kids to school, and we can do that. All we got to do is wear a mask. And I don't get the economic argument that we should just open up businesses because they're failing. If we open up businesses and don't have some strict requirements, they'll be closed again. People won't go there. Maybe the business thinks they need to open, but people won't go there if they don't feel safe. You don't go to a restaurant that is shut down because they have rats and people are getting sick every time they go to the restaurant. Well, what's the difference? So it's simple. Wear a mask and we can put this behind us. You know, I'm a sci-fi kind of nut. I can't tell you how many virus movies I've seen. I don't watch them anymore, by the way. Thank goodness we're not turning into zombies. But, you know, every one of those movies tell the story, and it's not so far-fetched to see this happening. It is happening. had predictions of 250,000 people dying. We're at over 130,000 people dying. And it's our responsibility to save lives. And that's what I'm doing. I'm sure that's what Ken's doing. And that's what the governor is doing.
Before we go on, Dylan, I just want to share some quick numbers with folks. Because Commissioner Bernard talked about flattening the curve. And so far, we did do pretty good in Oregon, though it's beginning to climb, as he acknowledged. There are 771 actual ICU beds in the entire state of Oregon. There's only 130 of them currently available. There are 50 people with COVID in ICU beds. There are 30 actually on ventilators. There are only 41 of those ICU beds regionally available right here in Clackamas, Multnomah, and Washington County. So if we do not keep this curve as flattened as possible and we overload the ICU system, we will be unable to take care of people. So again, and I appreciate the previous caller's comments about the science and the experts from Johns Hopkins, CDC, and other locales. I am not an epidemiologist, and most of the people that are posting on Facebook aren't either. We need to pay attention to the experts.
All right, thank you very much. Thank you both very much for that. I'm going to do one thing real quick for the benefit of the attendees we have on the screen. Some things have been referenced in the conversation. I will just share. This is a page that the CDC has, in which they have put out as far as considerations for wearing cloth face coverings. You can go and check this out and see exactly why they have made these kind of recommendations. Additionally, the same thing on the Oregon Health Authority page. They've got a nice face coverings required statewide section here with mask guidance and an FAQ. This is from Governor Brown. Governor Brown's page at the top, well, it's just on the building safe, but if you Google the face coverings required statewide, you can see the information here. Clackamas County also offers, right off our coronavirus page, a button for face coverings and wearing a mask, where we give some helpful facts and what to be aware of. And lastly, it was also brought up powers of the governor. This is Oregon Law, ORS 401175, additional powers during an emergency. So if anyone is interested in all those, that is where you can find out information about them. I see we have a lot more hands that have gone up, which is great. I will get to many in a second. I will whip through 3 quick emails as well. From Britt. I literally do not understand why there needs to be a discussion on this. I think that everyone needs to follow science and health advisories. With freedom also comes responsibility. A mask is easy to use and does not cause any hindrance to breathing or whatever else people claim. It is not an attack on personal freedom. It is for the safety of others as well as the wearer. Some people are more likely to have complications from coronavirus than others, so why is it that someone's right to a fashion statement is more important than another's right to live? Wearing a mask is about others, so people just need to stop being selfish and think of others in this country. Freedom isn't about trampling all over everyone else just because you want to. Listen to the experts. They know what they are doing. That was from Britt. So thank you very much. The next is from Jim in Clackamas. I choose not to wear a mask. I feel my rights are slowly being taken from us, and I'm not going to let them take away my freedom. So that was from Jim. And another last one I'll relay for now from Anne. I believe the government has the right and the responsibility to study the data and ask us to do whatever it takes to stop the pandemic. Other countries have proven it works. It's not infringing on anyone's rights. People need to grow up and think about someone besides themselves. So there's 3 additional. We thank Anne, Jim, and Britt for those. And with that, we do have a lot of hands up. We will go over to, and I'll just say we have someone with their hand up for a second time. I will get to you if we have time, but I'll go to everyone else to get their first question in first. So excuse me for that. Next, Gary, Marshke. That's gonna be wrong. Gary, you are on. If you can go ahead and unmute yourself. I'm sorry, Gary Marsh. I'm gonna guess it's Marshke. You need to go ahead and unmute yourself, Gary, to be able to speak. If you are there, I'll also push a button real quick. to see if I can prompt you to do it. We can't hear you if you're there. Okay, I'm going to go ahead and put you back. We'll go to someone else, William Gifford. William, if you can go ahead and unmute yourself, good. And please provide your name, your general area, and keep your comment to a minute. Thank you very much.
William Gifford, Oregon City. A couple of quotes for you. One is, "Your freedom to swing your fist ends at my nose." It's pretty straightforward. But I know that a lot of Americans, including some that called in, are going to live by the new American motto of live free and die. That's all I got.
Okay. Thank you very much, William. Let's see. We'll go to one more. Let's go to Ray Herndon. So Ray, if you could go ahead and unmute yourself. Very good. And provide your name and your area and keep your comment to a minute. Thank you very much.
Ray Herndon, I live in Clackamas. I've listened to a lot of so-called experts, and they're all over the map to the point I am confused. I think they're either lying to me or don't know what they're talking about. I have lost confidence in all of them. I got no problem wearing masks indoors. I don't wear them outside just like Ken. He wears glasses. I can't see out because it fogs my glasses up.
Yeah.
But I don't believe these experts, the CDC. I don't trust. I read an article here a while back in the Oregonian about some so-called experts in our campuses talking about ventilation for schools. They were all wet. Everything they said was totally wrong. I'm a retired professional engineer. They didn't know what they're talking about. So these experts, I don't buy. Let's say I've got no trouble wearing that mask, but a lot of these recommendations are ego, not fact or science.
Well, thanks, Ray.
All right. Thank you very much for that, Ray. We'll bring in one more person real quickly here. Let's go with Robert Canberra. Robert Canberra. If you can go ahead and unmute yourself, Robert. And yep, there you go. And please give your name, your area, and keep your comment to a minute. Thank you.
Yeah, my name's Bob Canberra. I live in Canby. I'm retired from the Clackamas County, and I strongly support all of us wearing masks. I mean, if you look at what's happening across the nation, I think it's for all Americans to start to care about others, and to reach out and do the minimum, bare minimum. I'm not too sure why anybody in their right mind would ever contest sacrificing. We do it every day when we stop at a stop sign for the traffic. I mean, if we can all follow rules and stop at a stop sign, for heaven's sakes, this is more dangerous. This is killing people. This is getting people sick. All we're asking you to wear is a simple mask on your face and to care. This thing can go away if everybody was to give up themselves and to help others. And that's basically the message. Care. Thank you for this opportunity. I'm sorry I came late. I just saw this advertised in the newspaper, so I jumped on it right away to say my piece. Bless you guys' heart, and I hope I know the difficult spot you guys have to face with all the differences of opinion, but please, really believe in science. Thank you.
Thanks, Bob.
All right. Thank you very much for that, Bob. Okay, we'll do, I see some more hands going up, which is great. I'm going to do 2 more emails real quickly in the meantime. Okay, from Cam in Milwaukee. My family and I have had many discussions about this issue. I'm very lucky that everyone in my family wants to protect those around them. I have heard the personal freedom and liberties concerns, but my personal opinion as someone who is over 76 years old is that everyone is having their liberties messed with right now. Pandemics are not a permanent infringement, and the sooner we get it under control, the better. Sooner happens when we each help protect others by wearing our own masks. Thank you for listening. Thank you for that email, Cam in Milwaukee. One more from Adam. The mandate to wear masks and face coverings in public spaces absolutely infringes on personal freedoms. If people continue to follow the guidance as originally given in March to stay away from others if sick and practice good hygiene, then we can get through this pandemic no different than any other flu or cold season. Will some get sick and some die? Yes, but look at the national influenza and other respiratory illness annual stats from the CDC. Improper use and potentially any use of face coverings is more of a risk to the general public than anyone walking around who is perfectly healthy or otherwise asymptomatic, in quotes. Stop feeding the fear that Governor Brown wants. Again, that was from Adam. Okay, and we're going to go now back to Zoom. Debbie Rival, maybe rival, but probably Rival. Debbie, if you're on, you can go ahead and unmute yourself. Thanks very much. Please provide your name, your area, and your comment in a minute or so. Thank you very much.
Can you hear me?
Yes, go ahead.
All right, I'm actually Debbie Rival's daughter, and I'm 13 years old. I'm from Oregon City, and I do care about others, but I do not believe that we should be forced to wear a mask. Not everyone is able to wear masks. Some people have respiratory issues or other medical conditions that makes masks not only uncomfortable, but also dangerous. I'm fine with other people wearing masks. If they want to do that, I'm totally fine with that. And if I was going to visit my grandmother who has a compromised immune system, I would wear a mask and respect her. But the coronavirus is still very new, and there are studies, while there are some studies that show masks are effective, there are also studies that show masks aren't effective. So I feel that government and science should be separate, and we should be able to decide for ourselves if we want to wear a mask and not the government deciding for us. There are also other ways that we can protect our friends and family, like washing our hands, covering our coughs and sneezes, social distancing, and think of all the other ways that people can die, the abortion and car accidents. People die every year from that. And why is the governor all of a sudden so focused on the coronavirus and not that? And that's it. Thank you.
Well, I gotta somewhat respond, yeah, she doesn't have to wear a mask, but she shouldn't be going anywhere. People, yeah, like I said before, you live in society, you give up something. You're not gonna go out in your front yard and take your car apart and leave it there for a year. You have a responsibility to your neighbors. You're not gonna pour poison down the drain that gets to the river because you have a responsibility in the environment. You have a responsibility to protect and support your neighbors. Over here where I live in Canberra, I buy my grass or my hay from my cows from my neighbor. When I had a baby cow issue, my neighbor came over and helped me. When I need some help fixing something, my neighbors are here to help me. I'm willing to help them, and I'm willing to wear a mask to preserve their health and safety. And the governor isn't just making this up. This is real. This is not political. It's not a joke. It's reality. And I'm sorry. I mean, this is tough on all of us. I don't like it at all. This is the strangest. I'm 65, I think, and maybe 66. This is the strangest part of my life and something I'll never forget. And, the other thing is that the flu season comes. You say people die in the flu season. Well, the flu and this virus will kill so many people. Our emergency manager talked to a friend in New York where they have cooler vans parked, or what do you call it, cooler trucks parked, where the bodies are being stacked. Come on, you can't tell me this is fake and that we should not do something about it. We can't just let people die. And it's so simple. Just wear your mask.
All right. Thanks very much for that, Chair. We still have several hands up. I'm gonna read 3 or 4 emails real quick that have come in before this even started. Maria in Oregon City. I'm in full agreement with this mandate. We're out in the public, and the only way to protect me and others is by wearing the mask and following social distancing when possible. Thank you, Maria. Andrea in West Lynn. I have been a Clackamas County resident for over 20 years. I am unable to attend the mask session going on. I am writing to urge you all to continue to encourage the wide use of face coverings and masks. I would also encourage enforcement, especially if numbers of cases continue to escalate. There is clear scientific evidence that the use of face coverings and masks reduce the transmission of the virus. This remains critical as cases in our county and the rest of the metro area and state continue to go up. There is much we don't know about the long-term ramifications of the virus. However, mask use is proven effective in laboratory studies and real-life scenarios. It is dangerous and short-sighted to consider this an issue of freedom and personal liberties, nor is it a political issue. This is a serious virus that any one of us could contract. It is a potential life and death issue. I urge you to continue enforcing the use of face coverings and masks in Clackamas County for the welfare of all of us. That was from Andrea in West Lynn. 2 more quick ones before we go back to Zoom. Melissa, I appreciate you asking public opinion, but why do we ask people their feelings about seatbelts? Why speed limits? We're in a pandemic. We've had to shut down. People have been impacted in so many ways. One of the simplest, easiest, and most community-minded things we can do is wear a mask. If we could all be trusted to do one simple task, we'd be in a better place. Seems we can't. Now it's a mandate. That's a temporary state law. What's the argument? Stop whining, wear a mask, period. That was from Melissa. And the last one is from Steve. Whatever happened to 15 days to flatten the curve? Why should we take advice from admitted liars like Dr. Fauci and the Surgeon General? That was it. I can't speak to that one. So, okay.
Let's see if we can get Gary in. He was the one who couldn't get his mic on. See if you can get Gary in there.
Oh, right. Okay. Sorry. For a second, I thought you meant Gary Schmidt, and I was really confused. Okay. Just 1 second. Okay. Allowed to talk, Gary. Where'd he go? I don't know where he went, Commissioner. There he is. Okay. Okay, Gary, we're going to you, Gary Marschke. If you are there and you want to try to unmute yourself again, we tried to get to you earlier.
There we
you
go. I think I got you. I think I got me unmuted.
Very
Well, thank
good.
you. First of all, Chair and Commissioner Humbertson, by the way, thank you for doing this. I think this is a wonderful opportunity to hear from a lot of different folks, from a lot of different perspectives. And it's pretty interesting. I think, my opinion, and very, very simply, is you can't separate the politics and the science, unfortunately, although they perhaps should be. And certainly one should be guided by the other when public safety and public health is at stake. However, I'm old enough, I think like Chair Bernard, to remember the days of odd and even gasoline rationing and other mandates that came down from a very conservative Republican who is probably hero worshipped by a lot of people who think that this pandemic is a hoax. So I think that we really need to take a look at the perspective of history. We need to look at the context of the pandemic and understand and appreciate the fact that this is real, that it isn't just politics, even though politics is mixed in it. And I'm speaking from a public health perspective, dealing with our constituency with National Alliance on Mental Illness. And I can tell you that there's a huge amount of anxiety out there among people who have mental health issues because people are disputing the validity of this and making them question whether or not they're safe to leave their houses. And you're talking about people who are already traumatized by a variety of different things. And now, as a result of not even being willing to practice common sense in some cases, much less common courtesy to your neighbors, we've got people who are experiencing additional trauma. So needless to say, I am in full and complete support of the mandate. If you don't, you wouldn't need a mandate if people were practicing common sense and doing all the other things that need to be done. But when we see a spike in viruses, I'm worried about opening schools. I really hope that the school systems are taking the steps necessary to ensure that our kids are protected. I just read a story that came through from German media that said that students may actually, or young children, may actually be a buffer to help us get through this pandemic. And I'm thinking to myself, oh, there's a wonderful approach. Let's shove the children out front and walk behind them. So I really hope that that's not what we're doing. And I really hope that this mandate is effective and it doesn't need to live any longer than possible. That's my two.
Thank you, Gary.
Thank you.
Thank you very much for that, Gary. Okay, we will also go next to, let's see, Tonya Reed. So Tonya, if you're out there, if you can go ahead and unmute yourself, you are on. So please write your name, your area, and keep your comment to a minute. Thank you.
Hi, I'm Tonya Reed, and I'm from Happy Valley. I wasn't planning on talking. I'd already sent an email. That was the first one you read, so thank you for that. But as I was listening, it dawned on me how pleased I am to hear that the commissioner and the chair are supporting masks. And that's what prompted me to raise my hand here. Was I just wanted to let you know that the online presence, the Clackamas County page and the commissioner's pages aren't necessarily coming across as definitive one way or another. And it's not just me. There's been a lot of chit chat going on about we were assuming that the commissioners as a whole were anti-mask. So I just wanted to put that out there to make sure that you are understanding the perceptions of the writing that's on Facebook, and hopefully encourage you to make stronger wording and stronger education and stronger emphasis on, you know, the benefits of masks, the education that needs to go along with that. And then just another little side note, looking up the history of mask use, I thought that was really helpful because this predates the 19th century. This is nothing new. And so looking at the education, just sharing historical facts, sharing the scientific evidence to show your support of mask wearing, I think would be really beneficial. So thank you again for letting me raise my hand and put my 2 cents in here.
Thank you.
Thank you very much for that, Tonya. I appreciate that. And let me see. We will go to more hands in a second, but I will take the opportunity because Tonya raised it. We do, although it's not on the county commissioners homepage, the county commissioners are of course responsible for overseeing all staff of the county. And we do have an entire coronavirus page, coronavirus in Clackamas County, which is run by the members of the EOC, who of course report to county commissioners. And you can go ahead and see many of the ways that we are putting out information about combating coronavirus there. So while it might not be, of course, on the commissioner specific page, we do have that page there, just to go ahead and state it. Next, we are going to go to someone on the phone, so I don't have the name, but if your phone number starts with a 612 area code. I think you're on right now, but if you can go ahead and hit the mute from your computer, otherwise there's going to be feedback. So if you can give your name and your area and keep your comment to a minute. Thank you very much.
Hello, my name is Monica and I'm calling from West Lynn. And of course, we wear masks when we go outside and when we are in shops as a courtesy to our neighbors. So personally, we do have difficulty breathing. Me, my husband, and my daughter. My husband in particular, he's older, and it is troublesome for him. We wear them professionally, and we wear them because we're good neighbors. We would like to be good neighbors, and we appreciate that our neighbors are concerned. But again, we would prefer not to, and so I just humbly ask that you create some time, perhaps, or some spaces where people can move, who like to move without masks, can move without masks, and the mask people can know that we'll be out there and can give us some time to enjoy the world the way we prefer to live it. And also, we are very restrictive personally of our medical treatment, and we three are very willing to sign whatever you need that we will not obtain medical. If we do get the COVID or anything, if we get anything, we will bow out. They'll continue to pay our premiums. We will bow out of your system. we understand that that is your primary concern. Thank you.
Thank you.
All right, thank you very much for that comment. And commissioners, we have 2 hands up additionally that we have not heard from those individuals before, so if you'll bear with me, we might go just a minute or 2 past the 2:30, but I would like to go ahead and make sure these 2 individuals have a chance to go ahead and say it. So the first I'm bringing over, the handle is just B. Macaulay. B. Macaulay, if you could go ahead and unmute yourself. There you go. Please give your name, your area, and keep your comment to a minute. Thank you very much.
Hi, my name's B. Macaulay, and I'm in Oak Grove. I just want to say that as far as the mask issue goes, I wear a mask. I would have worn a mask before COVID started. I sanitize my hands when I go into a store. Especially during flu season. It's just something that I do. I think it's just common knowledge and to keep yourself safe from the flu bug, any flu bug. But the issue that I feel about the mask and wearing the mask and having everybody make you wear a mask and feel sorry for everybody not wearing a mask or whatever, the real issue is about ethics and trust, about those who are in power. Do we trust them? Do we believe them? And that's the real issue. People are arguing about this not because they want to help their neighbor, or everybody wants to be concerned about their neighbors. It's just a given. But when we've got those in power gaslighting us, it's crazy making, and it's on a worldwide crazy making. And I don't know about you, but what I'm being told, there's you get one recommendation, and everybody jumps on board, and then you get another recommendation. Oh, no, that's not good anymore. We're not doing that. The numbers are crazy. They're absolutely nuts. And the people who are in authority, quote, we've got a world, a globe of the most intelligent people on the planet who are not able to speak. And they're censored. We have to listen to these few people who have the power, who have the money. And ultimately, this mask thing that's keeping everybody all occupied is about what's coming next. It's not about the mask. The mask is just teaching us to train each other and tattle on each other. But what's coming next? And what's coming next is a vaccine. And that's what we need to be looking at. We need to be looking at globally getting someone poking a needle in you with whatever they feel they want to poke you with. It's not about the mask. This is just conditioning you.
Okay, B, thank you very much. Thank you very much for that comment. All right, and our last comment we are going to go to is the handle is just Smitty. So Smitty, if you are out there, if you can go ahead and there we go. Provide your name and your area, and keep your comment to a minute, please. Thank you.
All right, my name is Carl Schmidt. I live in Milwaukee, and I just have a couple quick comments. One, to the people who are talking about how dangerous masks are. My father died of coronavirus, and I would invite anybody who believes masks are dangerous to reply, to tell me how dangerous those masks were compared to the coronavirus. By the way, my dad was a non-believer in the coronavirus up until he was in the hospital and sick with it. And the other thing is that trial and error is the lowest form of learning. And the reality of this is that we are not flying blind. There are plenty of other, nations. There are plenty of other places around the world who have done a much better job of actually pulling together and squelching the coronavirus. And for us to kind of be, dickering over oh my, I don't like wearing a mask, or just these kind of petty things. It just is so disheartening. And with that, thanks for the meeting, and have a good day.
Thank you. Sorry about your dad, and we could save a lot of lives if we just gave up a little bit and wore masks.
Yes, thank you very much for sharing that. Commissioners, I'm going to kick it to you in just 1 second for any closing comments that you have. But first, my apologies to those who have their hand raised for a second time that we weren't able to get to your comments, but we thank you for making your first comment, and we thank everybody on the Zoom call for participating. And I would like to thank everybody else who has gone ahead and emailed in their comments. I would estimate we've got probably 30, maybe 30 plus that we did not get to read today. So thank you very much. I will take this opportunity because of that to go ahead and remind individuals that the county commissioners welcome all comments related to county business at their business meetings on Thursday. Those are held at 10 a.m. on Thursday mornings typically. I am on the front screen here of our website. You can get to those through here by clicking your Clackamas County Board of Commissioners. And then it goes ahead, not only does it list things on the calendar, but if you click on business meetings, you can go ahead and see when the next one is, this one that I'm talking about tomorrow. If you click on it, it has all the information about joining it via Zoom and joining via the telephone. And additionally, you are always welcome at any time to send the BCC any general comments you have on any matter to bcc@clackamas.us. So again, my apologies that we did not get to many of the comments today, but again, we thank you all for joining us and for sending in the comments. With that, Chair Bernard or Commissioner Humberston, if either of you have any closing comments, please feel free.
Ken, go ahead.
Oh, you're on mute, Commissioner. Commissioner, you're on mute. Sorry. It's not doing it. That's weird. Let me see. There we go. Oh, it did it for a second. There we go.
There we are. I want to thank everybody who participated, both those who are for the masks and those who are against the masks. I do understand the personal freedom argument. The person who talked about motorcycle helmets resonated with me very quickly. I haven't ridden a motorcycle for many, many years and also had 3 high-speed crashes where I cracked 3 helmets. I'm glad there was a mandate to wear the helmet. I probably would not be here if I had not worn a helmet. For those who are opposed to wearing masks, I would simply ask you, as a favor to your friends and neighbors, to set aside your skepticism and answer this question: what do you have to lose? This is not going to hurt you. It may help others. And we do live in a society where we do try to help each other. So I'd respectfully ask you to wear the mask when you're in public and protect others, just in case you might have been exposed to this. And I, like my fellow commissioners, we want everybody to stay healthy. We want to get through this as quickly as possible. We want to get our businesses back open and people back to work as quickly as possible. And the way that we do that is that we keep these numbers down, drive them further down so that we can get open again. Thank you, and I'll turn it back over to Chair Bernard.
Well, we're a little bit over time, but I just want the next phase of this process will be vaccinations. I was around when polio vaccines came out. There were a couple of others, sugar cubes, medication, where the whole town lined up to go to Milwaukee High School to get their shots or their sugar cubes or whatever all those were. The scary part is that there will be people who will refuse to do that. And polio, by the way, was almost eliminated in this world by the gosh dang Ken, what is it?
Rotary's been working that for 100 years.
Yes, almost eliminated, but some religious restrictions, some personal restrictions. People didn't get the polio vaccine, and consequently, it is back alive, not as bad as it used to be. But please, when the opportunity arises, save yourself, save your neighbor, and do what's right. Thank you all for attending today.
Excellent. My thanks to Chair Bernard and Commissioner Humberson for joining us today, and everyone for tuning into the listening session. Last thing I'll do, I'll share my screen once more and let individuals know if you're interested in getting notifications as to when the next listening session is. On our website, you can always go all the way down on most of our pages right here to get email updates. And if you click on that, you can sign up for any of our forums. Typically, anything that we do with listening sessions with this check mark of the Board of County Commissioners. And that is where you can get them. And along with our social media, we do everything on our social media as well. So for Dylan Blaylock and Clackamas County, thanks very much. We appreciate you coming. Have a good day.
Long.